Today on Catholic Health Conversations in Care, an in-depth conversation on Alzheimer's and dementia. We'll take a look at breakthroughs in early detection and treatment and Catholic Health's ongoing compassionate care. Welcome to Catholic Health Conversations in Care. I'm Colleen McVeigh. Well, do you know someone with Alzheimer's or dementia, or someone caring for a loved one? Most, if not all of us do. It is a devastating disease with no cure, but advancements are being made in early detection, diagnosis, and treatment. And joining us today with the latest on all of that is Dr. Bruce Mayerson, Catholic Health's co-chairman of neurosciences and chief of neurology at St. Catherine of Siena Hospital. Dr. Mayerson, welcome, welcome, welcome. I'm so happy you're here. There's so much to talk about today.
Good afternoon. Thank you for having me.
This affects millions of us. Right now, nearly 7.5 million Americans?
Yeah, on the order of 7 million.
Over 65.
Yeah.
Living with Alzheimer's.
Correct.
But I want to start with something that really I didn't know about for a very long time, and I think a lot of people are confused about. I thought Alzheimer's and dementia were the same thing.
So this is a common question that comes up in the office. We see a lot of patients with dementia and memory problems, and it's one of the most common things that family members say is, well, is this dementia, if we start talking about this? And this is my trademark line is always, all Alzheimer's is dementia, but not all dementia is Alzheimer's. And what I mean by that is that there are many different neurodegenerative illnesses that can cause dementia, which is a progressive declining cognitive function over time. By far the most common is Alzheimer's disease, but again, there are many others: vascular dementia, Lewy body disease, other diseases that can cause dementia that are not Alzheimer's disease. And Alzheimer's disease is a very specific type of dementia. And again, important because it's the most common one.
Right. And that's where, like I said, nearly 7.5 million Americans over the age of 65 now living with Alzheimer's, which that's about 11% of the population over 65. That affects so many people living with it, so many people taking care of people with Alzheimer's.
And with the aging baby boomers, it's really become, almost epidemic. And I can't tell you the number of people I see on a weekly basis whose chief complaint in the office is memory loss. So it's a major issue. Yeah,
I was looking up with Alzheimer's Association, and this statistic I just was so surprised at. 1 in 3 older Americans dies from Alzheimer's. It is more than the breast and pancreatic cancer put together. Combined.
Right.
Yeah. So I didn't realize that many Americans are dying from
it seems like everybody knows someone, has a family member, has a friend who is suffering from this condition, and because of the nature of the condition affecting the brain and really the very essence of who you are, it's particularly devastating to families, and that's why I think it's taken such a front role.
Let's talk about detection, because that's where it's going to start, and I feel like it's going to start with the patient. I'm the one that's got to realize, okay, maybe it's time for me to talk to a specialist about memory loss or what's going on with me. So what am I looking for?
So what you're saying is important, because I think that obviously if the patient is recognizing their symptoms, that's very concerning to them and disconcerting. That said, oftentimes people who come to the office with these complaints are actually not the ones complaining. It's family members, it's friends, it's people they work with who are telling them things, and frequently they're unaware of it, which is actually one of the symptoms of dementia, is being unaware of it. So, depending on who, there are people who are aware of it clearly, but the ones that aren't pose a special challenge when we're trying to evaluate them and examine them with the standard tests that we use. So
what are some of the symptoms?
well, the most common symptom that we see with Alzheimer's disease is memory loss. It typically affects short-term memory, which means memory for recent events, things maybe that were just learned. Remote memory tends to be intact. So I often hear somebody will say, oh, I remember, or the family will say, oh, she or he remembers something from 30, 40 years ago, like it was yesterday, but they can't remember where we just went for lunch, or where we just said we were going for lunch, or that sort of thing. So that manifests as repetition of questions, which is a very common first sign or symptom that there is something wrong. Again, typically noted by close family members, spouses and children.
And I guess somebody who maybe has a family history would worry a little bit more about this?
Sure, that's actually a very common one. Having a family history of Alzheimer's disease does not guarantee that you will get Alzheimer's disease, but obviously it increased the risk. And there are genes that we can look for to assess and risk stratify people when appropriate.
Okay, so let's go the next step, diagnosis.
Right into diagnosis. So
right into it.
Yeah, so up until these newer drugs came out, we really did not have a great way to diagnose Alzheimer's disease in life when people were alive. I mean, the gold standard was autopsy, at which point it doesn't matter to most people affected, right? Of course. However, with these new drugs that have become available, diagnostically, we have really had an explosion in what we can do to make the diagnosis of disease. Three main ways that we can do it. One is with CSF, cerebrospinal fluid. We can do a minimally invasive lumbar puncture spinal tap, drain some fluid from the back, take the fluid, send it to the lab, and check for the abnormal proteins that may be present, elevated or decreased in Alzheimer's disease. That's the most invasive way, and again, it is minimally invasive. The other way, which has become really sort of the standard by which we're deciding which patients would be good candidates for treatment, is a PET scan called an amyvid scan, AMYVID, and it looks for the amyloid protein, which is the abnormal protein that accumulates in the brains of people who have Alzheimer's disease. And the last way is by blood work. We actually now have a blood test.
Really?
Yes. It's called a p-tau. It's fresh. P-tau 217. I would say it's been months since it has become commercially available.
Wow.
Most insurance companies and Medicare, I don't think are paying for it, but I think for $400 out of pocket, you can do that. That's probably the easiest and least invasive thing.
Oh, wow. That's amazing.
So it's very, phosphorylated tau 217.
Okay. So.
Yeah. Which is nice. So we didn't have any of these things.
No.
I mean, they were available in the research setting for decades, but in terms of making the diagnosis in patients who come to your office, we didn't have any of this available. So it's very exciting.
Oh, that is extremely exciting.
Yes.
Okay, so now I'm going to go to treatment, and that too. There are advancements. You could do anything. Again, as we discussed earlier, there was a lot of therapeutic nihilism around this disease because we really didn't have anything that could affect the natural course of the illness, and even the medicines that we used for some symptomatic type treatment. Did not have a robust effect. They weren't a dramatic, sort of improvement for most people. But over the past 3 to 4 years, the FDA has approved 3, and now they're only using 2 of these monoclonal antibodies, which are infusions, drugs that you go to an infusion center for and get an intravenous infusion, and you do that either twice a month or once a month, depending on which drug you're using. And you get the infusion, you relax, watch TV, you have people around you serving you, and after the infusion is complete, you go home, and that's the end of the story until the next cycle. And it's not a cure.
It's right.
You're finding it does what?
So what it does is it slows down the cognitive decline in patients with Alzheimer's disease. It is not a cure, but it has a modest impact on slowing down the progression of the illness. And again, we never had that before. So for us, this is huge news.
This is huge news.
Huge.
Is there anything we can do preventatively?
Yeah, I think that lifestyle modifications and treating other medical conditions are the best ways in general to decrease your risk of developing this. Risk factors for vascular disease like hypertension, diabetes, cholesterol, things like that, and managing those are one way to mitigate your risk. As far as other interventions that one can do on their own, I think exercise may be the most important one, which is a regular regimen of exercise, both aerobic and aerobic. I think diet, including in particular the Mediterranean diet, which can be a very tasty way to eat that is healthy as well, and things like treating sleep apnea so that you do get restorative sleep. And one underrated risk factor is hearing loss. Hearing loss is interesting because not only is it a risk factor for getting dementia itself, but it can also make dementia look worse because sometimes people speaking to people don't know what they're hearing and what they're not hearing. Yeah. So that's a big one that I think people don't think about a lot.
Yeah, I think there are a lot of people out there right now going, what?
What? Yeah.
Besides what, I can't hear you, what? I'm deaf in one ear.
What do you say?
I'm deaf in one ear, so I can make, but that's so amazing.
Yeah.
Yeah.
So there are things we can do is the bottom line.
That's even that risk factor of not hearing.
Yeah.
To know about that.
Yeah.
Okay. So I want everybody. Will you stick around for a little bit?
Yeah, of course.
Okay. I want everyone to. You can find out more about Catholic Health's Alzheimer's and Dementia program. The website is CatholicHealthLI.org. There's also a phone number 631-474-6285. So we'll be back with Dr. Mayerson, but coming up next, a Long Island woman shares her story on finding help and hope thanks to Catholic Health's Dementia and Alzheimer's program. We will be right back.
When you come to Catholic Health Cancer Institute, we'll get to know you. Every detail, from the genetic makeup of your cancer to your other health conditions to your emotional and physical needs. Because each detail gives us another opportunity to personalize your care and improve your outcome. And all of them can add up to a life-changing difference. At Catholic Health, we know you, we know cancer, and we know your cancer.
As farmers and ranchers, stewardship of the land comes naturally. You help keep water clean, improve the soil, and provide habitat for wildlife. But did you know that conservation can also improve your bottom line? Learn more at conservationpays.org.
Welcome back to Catholic Health Conversations in Care, and today's conversation about Alzheimer's and dementia. Now, earlier, Dr. Bruce Mayerson told us how some therapies can slow the progress of Alzheimer's. Well, next we hear from a woman who says the treatments she's getting are making a difference. Here, Catherine Borg shares her story.
As I've gotten older, I realized I couldn't find words. I got lost on the expressway one day, and I just felt it was time. My mother, then on my father's side, my 3 aunts were all very bad with dementia. There's just so much sadness because that's not your mother anymore. That's not your father anymore. It's not your aunt anymore. It weighs on your mind that what's it going to be in 5 years if I don't get treatment? I made my own appointment with a neurologist. The diagnosis was mild cognitive decline. Come back in a year. That just didn't satisfy me. I went to my regular physician. He said, I think I have somebody who may be able to help you, and it was Dr. Bertia.
The basic pathology with Alzheimer's disease is there's amyloid plaques and neurofibrillary tangles that are formed in the brain cells. This medication takes the amyloid plaques from the brain away. If they get into moderate and severe stages, the medications do not really work.
The first time I came for the infusion, the next day, there was just a remarkable difference in me. Just from that one infusion, my other half noticed it also. He says to me, you're different today. I am just thrilled and thankful to my regular physician for recommending me to Dr. Bertia.
Her initial complaint was she forgot her way to her friend's house. And now she's able to go back and drive back to her friend's house without any difficulty. She's also having difficulty with speaking, but with this medication, she's able to verbalize the thought that she has. So I think that this medication has helped her. So words are coming out, meaning you're able to think and say.
Yes.
Before it wasn't.
Correct. When the words were hard to find, it was discouraging to talk to somebody.
That better?
That does appear better, yes.
The Early Dementia Program is an interdisciplinary program that involves my field, neuropsychology, neurology, as well as pharmacology and the infusion center. And our job is to really make sure that our patients get the best treatment possible. These are newer treatments from a clinical perspective. And what they do is they allow us to have better control of helping patients have better quality of life because they really do minimize the progression over time. The older medications would kind of serve as a Band-Aid. So these are a lot better in the sense that we can have more control over disease progress.
I have told so many people about this, and they're like, we never knew that there was even a treatment out there. I am just so personally relieved that there is a program that most people are completely unaware of. To know, for me personally, there could be a light at the end of the tunnel. And like I told my children, I said, I know if I don't go for this treatment, I know what my future will be, and I don't want it. To me, this has just been a blessing. I don't mind telling people that, yes, I was diagnosed with this. I'm just glad that we're addressing it.
And joining us once again, Dr. Bruce Mayerson, Catholic Health's co-chair of neurosciences. And I had you stick around because that story was so beautiful. And I love that Catherine is trying to share her story, first to raise awareness, but also I like how proactive she was.
Yeah, I mean, and the fact that she still had the wherewithal, the cognitive wherewithal to realize that something was wrong. She's a perfect candidate for treatment because she's obviously very early on in her diagnosis. And she mentioned that before she was actually diagnosed, she was told she had mild cognitive impairment, which is an actual diagnosis of which half of those patients will go on to develop Alzheimer's disease. So it sounds like this was a pretty typical story of somebody who had some of these issues with memory, was diagnosed with mild cognitive impairment, and then probably went for some of the further testing, either an amyvid scan or the blood test or maybe a lumbar puncture, so that they could make the diagnosis and treat her. We have to be able to make the diagnosis to treat them and make sure it's not another form of dementia that would not be amenable to treatment. So that's where that comes in.
And how important that early detection is, or diagnosis?
The earlier you're treated, the better you do in general. I suspect there's going to come a point down the road even where pre-symptomatic people who aren't even symptomatic yet, who may be high risk, get diagnosed and get treated, and they may do the best out of everybody.
Is that what Dr. Bertia said, was the infusions actually work better early on?
Yeah, the earlier you infuse the patients, the better they do. People who are in the mild stages, really, the only people who are candidates for the drug are those who are really in the early stages. Once you get into the moderate or severe, you're too far advanced for the medications to have the benefit, and then it doesn't pay.
And we're talking about, Catholic Health. It's a care team.
Yes.
Because we saw Dr. Bertia and also Dr. Roseman, and she is a neuropsychologist.
She's a neuropsychologist. So one of the nice things about Catholic Health is that we really do have a multidisciplinary center of excellence for this, where we have people ranging from your primary care to your referral neurologist to your neuropsychologists. We have physical therapists. We have speech therapists. So there's many different angles that we are able to attack this from, and I think that it's one of the things that makes us unique right now in treating these conditions.
And again, what she said, A lot of people don't even, I'm sitting here telling you, I haven't heard of some of these things. So there's so many people out there who really don't know the latest advances.
Yeah. I think, you hear snippets in the news and you get some of your information that way. But yeah, you're right. I mean, some of the more nuanced details about treatment, people are not well aware of.
Yeah. Well, I thank you. Thank you for being here. Thank you for sticking around a little bit longer. I appreciate it.
Thank you for having me.
Yeah.
Appreciate it.
I want to thank Catherine Bork, too, for sharing her story. For more information, once again, go to CatholicHealthLI.org, or you can call 631-474-6285. And coming up next, we'll see how people living with Alzheimer's are getting help navigating everyday life thanks to the team at Catholic Health. We'll be right back.
We put food back on tables, support local workers, unlock doors, and walk together on the road back. Help Catholic Charities serve your neighbors in need. Join us at wearethere.us.
Welcome back to Catholic Health, Conversations in Care. Today we're talking about Catholic Health's Alzheimer's and Dementia program, which includes a team of neurologists, neuropsychologists, geriatric specialists, psychiatrists, social workers, and other experts who all collaborate to provide compassionate care and a better quality of life. Well, now here's Catholic Health's Tim Kelchner with a look at another special part of this program that is helping Long Islanders each and every day.
Thanks, Colleen. I'm here at the Integrative Medicine Program at Catholic Health, and I'm joined by Dr. Rebecca Fishman. She is the Director of Integrative and Anti-Aging Medicine at Catholic Health, and she's here to talk to us today about how this program ties into the Dementia and Alzheimer's program at Catholic Health. Dr. Fishman, thank you so much for joining me.
Thank you. Thank you for having me.
I think this is such a cool program, and the fact that it ties into our Dementia and Alzheimer's program just makes it even more special. This is fantastic. Can you first provide an overview of the Integrative Health program at Catholic Health?
Sure, absolutely. So in integrative medicine and our center here, our goal is to identify those modifiable contributors that are influencing our cognition, our neuroinflammation, our resilience, right, our quality of life. And we do this by identifying those risk factors and addressing them so that we can address all issues across a broad spectrum of cognitive decline.
So this is something, I know we're talking specifically about dementia and Alzheimer's, but this program really can help everyone out.
Yes.
And the fact that it has a specialized component just for those experiencing cognitive decline, I think is really cool. Can you get in, I guess, specifically when you have patients who are experiencing dementia or Alzheimer's? What does that entail?
Exactly, especially in the early stages of mild cognitive impairment. The way I best explain this to patients is I tell people, think of a big stovetop. It's like my best analogy. A big stovetop that has tons and tons of burners on it. And at the top of that stovetop is a smoke alarm. And that smoke alarm is neuroinflammation, cognitive decline. Each of those burners represent a cause, a source of inflammation that will make that smoke alarm go off. So what we do is we look at each of those burners. In particular, there are things like sleep optimization, gut health, fitness, and we look to see which is the highest flame, and we try to reduce those. And we do this with specialized testing to identify them, and then we have an entire team here that works together, our nutritionist, our health coach, our exercise physiologist, physical therapist, the physicians, and we all work together to help the patient navigate through this. Each of those flames actually are not just a flame by themselves, but they actually contribute to other flames. So if I have one flame that's up, it actually causes another flame to go up. So it's not just, medical evidence supports multiple modifiers happening at once. So fitness is just one of those burners, but it's an important burner. And that's one of the areas we focus on here. So for example, we have different machines that will address the biggest key to longevity is going to be, and cognitive health, is going to be lean mass, maintaining lean mass, and VO2 max. This is the keys that they talk about. This is the currency of aging. And so our VO2 max machine, which we have here, will assess really how much oxygen a patient brings into their lungs, and then how much it gets into the bloodstream, then goes to the heart and the vascular system, and gets delivered to our muscles, into our mitochondria. So we have energy. The brain absorbs a tremendous amount of energy. It requires a tremendous amount of energy, so you really do need mitochondria. So fitness is not just going to be VO2 max training, it's where we can identify how much oxygen you could breathe in and utilize. So that tells us basically it's a quick snapshot of the entire energy system of the body, how the body utilizes its energy. The other piece to this is going to be lean mass. And we have a machine called the Sika, and the Sika is a body scan composition. So it's not just getting on a scale and saying your BMI is whatever. It's actually telling us how much lean mass you have, how much fat mass you have, how much visceral fat you have, which is the fat that's underneath the muscles and surrounds the organs. And that fat is very inflammatory, which by itself is a burner, causes inflammation. So we can identify and track patients to see if their VO2 max is increasing, to see if we're gaining lean mass, and to see if we can reduce the visceral mass, causing inflammation in the body. So if somebody has issues with their knees, we have a bike as well. And it also depends on what they will be exercising with. So if somebody's primarily going to be doing bike training, this is a great way to assess your VO2 max. Somebody's going to be doing more walking or running, the treadmill is a great option.
So you really meet people where they're at in their health.
Absolutely. That's the only way to do it, right? Because we need to meet you where you're at and expand your health.
And just to get into a little bit more, why fitness testing is so important and really what you're trying to gain from all of this information.
By increasing your lean mass, you're basically making a sink, a reservoir for glucose to just go pouring in. So that's the first step. To basically keep your glucose optimized, you want to have lean mass. You also have your mitochondria in your lean mass. That's your energy. So if we lose lean mass as we get older, everybody decreases their lean mass as they age. Our goal is to maintain that. So you increase your mitochondria, you increase your glucose stability. But not only that, here's a little magic sauce. When you increase your muscle contraction, you're increasing something called BDNF, brain-derived neurotrophic factor. What that does is it increases neuroplasticity in the brain. So you can actually build your brain and help prevent the decline of Alzheimer's by exercising.
That's incredible. That's unbelievable. I know exercise that's where we're at right now, but the other big component that you mentioned was sleep. How does that play a role? And how do you work with patients to kind of monitor the sleep and see where they're at with their sleep journey?
So sleep is pivotal. I mean, this is the lowest hanging fruit, right? We need to sleep. But in sleep, we heal. In sleep, we turn short-term memory to long-term memory. In sleep, we detox. But something else happens that's magical in sleep. It's called the lymphatic system. It gets activated in delta, in deep sleep, and it cleans out the brain and the spinal cord of all the metabolites. So anything that's happening, all the junk that gets into the brain, it gets cleaned out. So if you're not sleeping, you're not cleaning out your brain and your spinal cord through the lymphatic system. So the other thing is you need oxygen. So if you have sleep apnea, so most of our patients will be sent for sleep study tests because it's very important. Again, you're not making your memories, you're not integrating your memories if you're not sleeping. So getting the right amount of sleep, making sure it's restorative sleep, will impact your cognitive health tremendously.
And again, I think that's good advice, not just for patients with dementia and Alzheimer's, but all of us can take some of that advice. That's such a good message, a good way to end it. Again, we're at the Integrative Health Program here at Catholic Health with Dr. Rebecca Fishman. Dr. Fishman, thank you.
Thank you.
Thanks, Tim, and a special thank you to Dr. Bruce Mayerson for sharing his expertise with us. We hope today's conversation gives you hope, because help is available, and advancements in early detection, diagnosis, and treatment are changing the conversation about Alzheimer's and dementia. For more information, go to catholichealthli.org or call 631-474-6285. And remember, at Catholic Health, compassionate care is close to home. Thank you so much for joining us. I'm Colleen McVeigh. We'll see you next time on Catholic Health Conversations in Care.